Did you know that after the age of 60, missing just one important health checkup could mean the difference between catching a disease early or finding it too late? Most seniors think they're fine if they feel okay, but here's the truth. Many of the most dangerous health problems for people over 60 start silently, with no pain, no symptoms, and no warning at all. That's why today, I'm sharing the 7 most important health checkups every senior must do regularly. These simple tests could protect your heart, your brain, your bones, your eyesight, and even your independence. So grab a notebook, because you'll want to remember each of these, and by the end, you'll know exactly how often you need to get them done and why skipping them could be risky. Let's start with the #1 silent killer, high blood pressure. Doctors often call it the silent killer because it can quietly damage your heart, kidneys, and even your brain without showing obvious symptoms. Here's why this matters for seniors. After 60, blood vessels naturally become stiffer. This makes the heart work harder to pump blood. Even small increases in blood pressure dramatically raise the risk of stroke, heart attack, and kidney disease. The checkup. Every senior over 60 should have their blood pressure checked at least once a year by a doctor. If you've already been diagnosed with hypertension, then it should be checked more often, sometimes even monthly. The home tip. A home blood pressure monitor is one of the smartest investments you can make. Regularly tracking your numbers helps you notice changes early before they cause big problems. Why this matters. Imagine catching rising blood pressure early. It's far easier to manage with lifestyle changes and mild medication, compared to waiting until it causes a stroke. So the first checkup every senior must never skip is a regular blood pressure and heart health screening. Next on the list, blood sugar and diabetes screening. Did you know that nearly 1 in 4 people over 60 have diabetes, and many don't even realize it? The problem is, uncontrolled blood sugar quietly damages blood vessels and nerves. Over time, it can affect the eyes, causing blindness, the kidneys, leading to kidney failure, the feet, causing poor circulation and even amputations, the brain, raising the risk of dementia and stroke. The checkup. Seniors over 60 should get a simple fasting blood sugar test or an HbA1c test at least once a year. This test shows your average blood sugar levels over the last 3 months. The warning sign. Even if you don't feel thirsty, tired, or notice vision changes, you could still have prediabetes. That's why testing is so critical. The good news. If doctors catch prediabetes early, lifestyle changes like daily walks, a balanced diet, and weight management can often reverse it without strong medication. So the second vital checkup is a yearly diabetes screening to protect your energy, eyesight, and independence. And remember, diabetes doesn't just affect your body. It can also affect your memory and mood, so controlling blood sugar means protecting your brain too. Now let's talk about something most seniors overlook until it's too late. Cholesterol levels. Cholesterol isn't always bad. You need it for hormones and cell repair. But when LDL, or the bad cholesterol, gets too high, it clogs your arteries like grease in a kitchen drain. Why does this matter more after 60? Blood vessels naturally get narrower with age. Plaque buildup from high cholesterol increases the chance of a heart attack or stroke. Many seniors don't feel any symptoms until the damage is advanced. The checkup. Every senior should get a fasting lipid profile test at least once every 1-2 years. If you already have high cholesterol, heart disease, or diabetes, your doctor may recommend testing more often. What the test shows: LDL, bad cholesterol; HDL, good cholesterol; triglycerides, another fat in the blood that raises heart risk. The good news: small lifestyle changes, like switching from fried foods to baked or grilled, adding more vegetables, or walking 30 minutes daily, can lower cholesterol without heavy medication for many seniors. So the third essential checkup is a cholesterol and lipid profile test to protect your arteries and your heart. Next comes a test especially important for seniors, especially women over 60, the bone density scan, also called a DEXA scan. Here's why it matters. As we age, bones naturally lose calcium and become thinner. This condition, known as osteoporosis, makes bones fragile and more likely to break. A simple fall, just slipping in the bathroom, could lead to a broken hip, which often takes seniors months to recover from, and sometimes leads to loss of independence. The checkup. Doctors recommend a bone density scan at least once after age 65 for women, and sometimes earlier if there are risk factors. Men over 70 should also be tested. Who needs it sooner? Seniors who smoke, those who drink a lot of alcohol, people with very low body weight. Anyone with a family history of osteoporosis. The benefit. Catching bone loss early means you can take steps, like vitamin D, calcium, exercise, or medications, to keep bones strong and prevent fractures. A real-life example. Think about how many seniors you've seen who stopped walking confidently after just one fall. A bone density test helps prevent that situation. So the fourth critical checkup is a bone density scan to protect your mobility and independence. Let's move to something many seniors notice but often ignore: changes in eyesight. Eyes naturally change with age. But here's the problem. Some of the most serious eye diseases start without pain or early warning signs. The three big ones are glaucoma, pressure in the eye that damages the optic nerve; cataracts, clouding of the lens that makes vision blurry; macular degeneration, loss of central vision, making it hard to read, drive, or recognize faces. The checkup. Every senior over 60 should have a comprehensive eye exam every 1 to 2 years, even if your vision seems fine. Why this matters? Glaucoma can steal vision without you realizing it. Cataracts are treatable if caught early. Eye exams can also show signs of diabetes or high blood pressure. A simple reminder. Think of it this way. Just like you clean your glasses regularly to see better, you should check your eyes regularly to keep your world bright and clear. So the fifth must-do checkup is a regular eye and vision exam to protect your independence and quality of life. Now let's talk about a topic many seniors worry about, but sometimes avoid discussing: cancer screenings. The truth is, some cancers are more common after 60, but the good news is, they can often be treated successfully if caught early. The key screenings: colorectal cancer, colonoscopy every 10 years, or stool-based tests more frequently; breast cancer, for women, mammogram every 1 to 2 years until age 74; prostate cancer, for men, blood test, PSA, depending on doctor's advice; skin cancer, a simple skin check by your doctor. Why it matters. Cancers often grow silently. By the time symptoms appear, treatment becomes harder. Early screening can literally save your life. A gentle reminder. Screenings might sound uncomfortable or scary, but they are far less frightening than facing late-stage cancer. Many seniors who took these tests discovered problems early, got treatment, and went back to enjoying life. So the sixth vital checkup is age-appropriate cancer screenings to catch problems early and stay ahead of disease. Finally, let's talk about something many seniors quietly worry about: memory loss and brain health. We all forget small things sometimes, like where we left our keys. But as we age, it's important to know the difference between normal forgetfulness and something more serious: like mild cognitive impairment or dementia. The checkup. Doctors recommend that seniors over 60 have a cognitive screening test every year during routine checkups. These are simple, short memory and thinking exercises, like recalling a list of words, drawing a clock, or answering quick questions. Why this matters. Catching memory issues early gives you more treatment options. Some problems, like vitamin deficiencies, thyroid issues, or medication side effects, can mimic memory loss, and they're reversible. Early detection also gives families time to plan and support seniors better. A gentle truth: your brain is like a muscle. The more you use it, the stronger it stays. Regular checkups, combined with brain-healthy habits like reading, puzzles, and socializing, can keep your memory sharper for longer. So the seventh vital checkup is a yearly memory and cognitive health screening to protect your independence and quality of life. Now let's quickly recap the 7 most important health checkups every senior over 60 should do regularly. Blood pressure and heart health, blood sugar, diabetes screening, cholesterol and lipid profile, bone density, scan eye and vision exam, cancer, screenings, memory and cognitive health checkups. Each of these tests may seem small, but together they create a safety net, protecting your heart, your bones, your vision, your brain, and ultimately, your independence. Remember, these checkups aren't just about finding illness. They're about giving you peace of mind, catching issues early, and making sure you can enjoy the things you love, whether that's walking with friends, playing with grandkids, or simply living each day with energy and clarity. So take this list with you to your next doctor's appointment. Ask which ones you need and how often. Your future self will thank you for it. And if you found this video helpful, don't forget to give it a thumbs up, subscribe for more senior health tips, and share it with someone you care about. Because staying healthy after 60 isn't just about adding years to your life, it's about adding life to your years.